Hi guys, Alan Eldridge from Optimal Movement Physical Therapy here in Redlands, California. I'm here with Sean Lee. We're going to be talking about hip extension range of motion assessment as well as prescribing a hip flexor stretch. Hip extension range of motion, the assessment is also known as the Thomas test. It's really important for individuals who have low back pain, especially with walking or running or prolonged standing. And the reason why is if we are lacking hip extension range of motion, we're actually designed to compensate for it by extending at our lumbar spine. And this excessive amount of extension over prolonged periods of running or walking can put undue stress on different structures in our lumbar spine and therefore cause some discomfort. It's also really important because as a society we tend to be sitting a lot, and when we're sitting down, our hip flexors are in a relatively short position. If we're sitting for hours at a time during the work week and then go for a long run during the weekend, our hip flexors have been in a shortened position all week long and aren't used to giving us any hip extension range of motion when we go out for a long walk or a long run. That could be another clue why you might do the Thomas test, is for individuals that say, hey, I can sit for a long period of time and my back feels pretty good, but when I'm walking or I'm running, that's when I really start to notice my low back pain. So we'll go over the Thomas test. Sean, go ahead and take a seat at the very edge of the table. You instruct your client to sit at the very edge of the table. Go ahead and put your hands under your knees and I'll just rock back together. Good. So things that we're looking for during this test is we're looking for excessive extension at the lumbar spine, we're looking for an anterior pelvic tilt, and we're also feeling for any unneeded pressure from the client into our side. Put a hand there at your side. All of these would be an indication that the client has run out of hip extension range of motion. So when you instruct your client to relax, you just lower down and you're feeling for pressure from the client's foot. You're also looking and or feeling for this anterior pelvic tilt. Once you feel it, you take a measurement. Ideally, the client should be at 0 degrees or even with the table. You can see Sean is lacking about 20-25 degrees of hip extension. And that's a pretty significant amount, especially for somebody who's running. So let's go into the hip flexor stretch. One of my favorite hip flexor stretches, and the reason I say favorite is because it's just simple, is the tall kneeling hip flexor stretch. Go ahead, Sean, you can get into it. Certainly there are more functional hip flexor stretches that he is working towards, but I find when somebody is lacking 25 degrees, they need a stretch where they can feel it. So we'll start here and we'll work our way up towards it. It's very simple. There are more aggressive versions of this stretch as well. But what he is focusing on is he's focusing on not letting his pelvis rotate. So ASIS on each side is both pointing in the same direction. He's going to brace from his abdominals. He's going to activate his glutes. And he'll push forward together until he feels stretching in the anterior portion of his hip. Once he feels that, he's going to hold it. It should be tolerable. Hold it for an appropriate period of time with the goal of getting his hip extension down to 0 degrees.